I like being able to work on something that's mine and that I've developed over several years. Having the flexibility to explore things that maybe if I was employed on a specific project I wouldn't be able to do. I'm Sarah, I'm a PhD student at the University of Exeter Medical School and I'm also a GP in Exeter, and my PhD is looking at trying to improve early cancer diagnosis in primary care. My research involves working with large databases of anonymous primary care data, building models to try and predict which patients may or may not have cancer. I've always really enjoyed the academic side of medicine. I did academic kind of modules alongside, and I intercalated a degree, a bachelor's degree alongside my medical degree. I was always looking for interesting research projects and I loved going to conferences. When I moved down to Exeter for my GP training, I looked around and found that there was a great primary care academic department here, and I started an academic clinical fellowship which gave me some academic time alongside my clinical GP training. I got publications, got to go to conferences, and I progressed this early cancer diagnosis theme. What I realised was that the cancer risk thresholds weren't being calculated in a way that maybe was as accurate as it could be. So I'm going to try and improve that using complex statistics on these big data sets, and I'm also using machine learning models as well. If we can diagnose earlier, they're more likely to survive their cancer. The NHS has a long-term plan which says by 2028, 75% of people are going to be diagnosed at an early stage, so there's lots of things that we need to tweak to try and improve that. Funding for clinical PhDs is quite complicated and competitive. I was fortunate to a Wellcome funded PhD scheme for primary care clinicians. It gave me an opportunity to apply for the funding and I was successful in that. To be here in the University of Exeter, where maintaining a clinical practice alongside your research is crucial. It brings you back to reality. Every time I go in, I'm thinking, oh, how could we improve this? How could this work? I'm able to go and seek out the best training. I went to Amsterdam to do a training course in clinical risk prediction modelling, which was amazing. A PhD is something that you need to want to do. Go and talk to the people that's going to be your supervisors. Make sure that you get on with them and that you trust them and that you're inspired by them.